which is that little country with the arrow pointing at it. It's next to Pakistan and India and China. And Bhutan is a country with a GDP like Vanuatu of about $500 a year, so right down at the bottom end of the scale. Cervical cancer right at the top of the scale of cancers for women, and a very young population. And we wondered whether it would be possible to get a vaccine program into a country where there are no roads for most of the people that you're trying to get to. But fortunately, we had the cooperation of the very small lady sitting between, or standing between me and my wife there. She was the royal grandmother. She still is the royal grandmother. She's 83 years old. She decided that her country should be vaccinated against cervical cancer. She was the champion for the program. Merck provided the vaccine, and she just told the two gentlemen in the saffron robes there, the Minister for Education and the Minister for Health, they were going to deliver a vaccine program, and they did. And they did it very effectively. They reckoned they got 100% of the eligible girls in the first year, and it was probably about right. But the more important message in this is this. The program was delivered in the first year through schools, and through schools, they got their 100% coverage. They then decided they could save money by delivering it through health centres. Health centres means the kids had to walk sometimes up to 5 hours to get the vaccine. And the drop-off rate was down to 60 to 70% coverage. So after 3 years of that, they went back to giving it through the schools and back up to nearly 100% coverage. So the message from there is school-based delivery is effective, and if you're going to have a universal immunization program in the developing world, it's best done through schools, as we also did in Vanuatu.